There are so many medical differential diagnoses. You have to make sure there isn't something sinister going on. For example, if there's an occult malignancy that could cause you to lose weight, whether you've got a chronic infection of any kind. The classic one that causes you to lose weight is tuberculosis, for example. Whether you have thyrotoxicosis that's causing you to lose weight and it's raising your metabolic rate, you need to do a proper physical workup to make sure that you're not missing something. Diabetes, if you've got undiagnosed diabetes, you lose weight. So you need to make sure you've not got any of those things. And often people who are restricting their diet, they start having a lot of gastrointestinal symptoms as well. Constipation because you're just not having enough fluid and food intake, stuff like that. So you have to make sure they haven't got a gastrointestinal problem. But at the same time, so I'm not saying, and it's really important that we do not miss something, but at the same time we shouldn't be completely fixated on the medical. You should always have at the back of your mind, is there a psychiatric element to this? And actually, look for the clues. And usually there will be clues and you will discover it. People go a long way down the road before anyone twigs. And we have got good evidence that actually people get better much quicker if they're picked up earlier. So that's quite an important thing. When you've gone all the way down the road, you won't want treatment. You have to be sectioned. You've lost so much weight, you're at significant risk to yourself. And if we can head off things earlier, that just makes such a difference. Things like depression, where people will tend to come and say, I feel miserable. So it's not that difficult. We do have research that says that people do often present to their GPs a lot in the period before they get diagnosed. So they're help seeking, but they may not say, I have a psychological problem, I don't want to gain weight, I'm trying to lose weight. So you do often get a bit of a wild goose chase of GPs or pediatricians trying to look for the cause of weight loss. And the thing is, you do have to make sure there isn't a medical cause. And in fact, sometimes there is a medical cause, but there may be a psychiatric reason. So you need to have a suspicion and never dismiss weight loss, because one of the worst things would be to miss a good medical underlying reason for weight loss. But at the same time also keep thinking, is there an eating disorder that they're not quite telling me about?